Fewer than half of the people in the Netherlands believe their healthcare system needs fundamental change. That system, in fact, ranks at the top of a European survey on healthcare satisfaction. The life expectancy in the Netherlands is 80 years, and people in the Netherlands have to buy health insurance because it's the law. Kitty Pilgrim has our report.
The Dutch reformed their healthcare system in 2006, and now every person is required by law to purchase health insurance from one of a dozen or so companies. David Helms of a non-profit health policy and research center has studied health systems in the Netherlands, the UK, and Germany.
They clearly have put in place a structure that permits competition among providers. They're opening up a system that was more controlled by government to more competition among the providers.
The Dutch government makes sure that industry is regulated and fair. Professor Alan Enthoven of Stanford authored the managed competition model the Dutch have embraced.
One of the things the Dutch do that we should do is have standardized coverage contracts, so there's no tricky exclusion, no confusion.
Although the system is based on private insurers, the government makes certain that no one is refused coverage based on age, gender, or pre-existing condition. University of Texas professor Pauline Rosenau has written extensively on the Dutch healthcare system.
And it's all part of what's outlined as the basic health insurance policy that the government, first of all, has an entire department that tells the insurance companies what they have to cover, and then sees to it and checks up that they are covering those things.
6.5% of income goes to health insurance in the Netherlands. Those who cannot afford that have their insurance costs subsidized by the government. The government, through an insurance pool, also compensates insurance companies for signing up people with poor health records or pre-existing conditions. All of this costs less than U.S. health care. The Dutch spend $3,527 a person on health care, while the U.S. spends $7,290. It is 9.8% of GDP in the Netherlands versus 16% in the U.S. There are considerably more doctors per capita in the Netherlands, 1 for 256 versus 1 for 416 in the United States. A chief strength is a network of family doctors who are deeply familiar with their patients. The Commonwealth Fund reports in a recent survey, 100% of people in the Netherlands have a regular doctor. The ultimate selling point, the average Dutch life expectancy is 80 years versus 78 in the United States. Now, many academics say there is much in the Dutch system that would work here in the United States. It's not perfect. The regulated private system does have many benefits and does move away from the current employer-based health care model. Senator Ron Wyden of Oregon and Republican Robert Bennett of Utah have proposed a health care plan that does incorporate many of the features of the Dutch system. Lou?
Thank you, Kate. One of the things we're seeing here, now we've gone through about six nations looking at the comparison. We're going to continue that. Probably we'll look at 25 systems before this is concluded, this series of special reports. But one of the things that must be fascinating to folks is to see that there are nations, I think most Americans think they have the highest life expectancy in the world. I think most Americans, and I'm saying this without any knowledge of any polling on it, I think they also believe that ours is the best and is not as far skewed in terms of the cost as it obviously is right now.
Mm-hmm. Yes, and when you do these cost comparisons, it's very interesting to see, and it's enlightening to see what works and what doesn't. You have all these test models out there globally. You can actually really look.
And oddly enough, the national media not focusing upon them, and oddly enough, neither the Democrats nor the Republicans focusing on them or trying to speak in the public debate about the merits and the deficiencies of each. We have the experience of all of these countries to draw upon, and our legislators and this administration and the administrations before it seemed absolutely intent on ignoring that as lessons.
A lot of lessons to be learned, a lot of information out there, and it should be used.
And we're going to continue to shed light on all of this and look forward to your doing so tomorrow evening. Thank you very much. Kitty Pilgrim.